Have you ever felt a simple ache and your mind just spirals? You start thinking the worst, and suddenly that little pain feels like it could change your whole life? Well, we're going to dive deep into that feeling today. This is an explainer on health anxiety, what it is, how it really works, and that critical line between a totally normal worry and a clinical concern. Let's get into it. You know the feeling, right? You notice a new ache, maybe a weird twitch or a cough that just won't quit. And for a split second, your mind just races. Is this it? Is this the start of something big? It's a completely universal human experience, that sudden jolt of fear. For most of us, that worry comes and goes. The pain fades, a doctor says you're fine, and we just move on. But what happens when it doesn't? What happens when that little spark of fear gets trapped, spinning around and around in a loop that takes over? That's what we're breaking down today. To really get this, we need to look under the hood. We need to look at the engine that drives this whole thing. And cognitive behavioral models give us this fantastic map for seeing how health anxiety starts and, more importantly, how it keeps itself going. So here it is, the engine itself, a really powerful feedback loop. It all kicks off with something super simple, a headache, a stomach gurgle, you name it. But then comes step 2, the catastrophic interpretation. Oh no, this has to be a tumor. That thought alone triggers real physical fear. Your heart starts pounding, you might feel dizzy. So to make that feeling go away, you do something. You check your body, you Google your symptoms, you call the doctor. And that might give you a little relief for a minute, but here's the kicker. It secretly reinforces the idea that the sensation was dangerous to begin with. It basically primes the pump, making the next cycle happen even faster. Okay, so this leads to the million-dollar question, right? Where is the line? How do you know when a normal, everyday health concern has tipped over into something more? How can you tell when that anxiety engine has gone into complete overdrive? This chart here really lays it all out. A normal worry, it's temporary. It goes away when a doctor tells you you're okay. But health anxiety, it's persistent. We're talking 6 months or more, even when all the tests come back negative. Normal worry is also contained. It doesn't stop you from going to work or seeing friends. Health anxiety is disruptive. It gets in the way of everything. And this last one is so important. Normal worry is responsive. You can accept reassurance. With health anxiety, that reassurance feels good for maybe a few hours or even a few minutes before the doubt just comes roaring back. So this brings us to the 2 main clinical diagnoses you'll hear about. First up is illness anxiety disorder. The key thing to understand here is that the person either has no physical symptoms at all or they're super mild. The real problem isn't a symptom, it's the intense, nonstop fear and worry of getting sick. And then we have somatic symptom disorder. Now, in this case, there are real, genuinely distressing physical symptoms. The issue is that the person's thoughts, their feelings, their behaviors about those symptoms are just excessive and all-consuming. The focus here is on that debilitating reaction to the physical feelings and how that reaction just wreaks havoc on their life. Okay, definitions are one thing, but stories are where it really clicks. So let's look at 3 different people, we'll call them Jane, Kathy, and Paul, to see how these different anxiety paths can play out in the real world. First, let's meet Jane. She finds a mole, her mind immediately jumps to cancer, which, let's be honest, is a totally common and understandable fear. She feels that anxiety, but she channels it into a clear, direct action. And right here, we see that anxiety cycle in action. But look at the outcome. Her behavior, going to the doctor, leads to credible reassurance. She believes it, the fear goes down, and boom, the loop is broken. This is a perfect example of a totally normal and honestly pretty helpful health concern.
Now let's turn to Kathy. Her story starts with a real illness that was actually treated successfully. The medical crisis is over, but for her, the mental one is really just getting started. Every single normal bodily sensation is now seen through the filter of her past trauma.
So look at Kathy's behaviors. They're all designed to control her fear, but they're actually pouring fuel on the fire. The constant need for reassurance, the endless doctor visits, avoiding any conversation about being sick, it all makes the fear bigger. The relief she gets is temporary because the core belief that her body is fundamentally unsafe never goes away. This is a classic example of illness anxiety disorder. And finally, there's Paul. Paul is having real, persistent chest and shoulder pain. He's gone through all the tests which show his heart is perfectly healthy, but the pain and his worry are only getting worse.
He's convinced the doctors must be missing something huge.
Paul's story is just a perfect illustration of somatic symptom disorder. Yeah, the symptoms are real, but his response to them creates this devastating feedback loop. He's so afraid that he stops all physical activity. But guess what? That leads to his body getting weaker and out of shape, which actually makes his pain and breathing feel worse. The very things he's doing to protect himself are actively making his physical symptoms worse and just tanking his quality of life.
So what is it? What makes one person's anxiety loop break, like Jane's, while another person's, like Kathy's or Paul's, just spirals out of control? Well, research points to a handful of things that can make someone more vulnerable.
First, it is so important to understand just how common this is. At any given moment, studies show that up to 20%, that's 1 in 5 people, are actively worried about having some kind of illness. It only really becomes a clinical issue when that worry just refuses to let go and starts getting in the way of living.
So, what kinds of things contribute? As you can see, the roots can be pretty varied. Having a serious illness in your past, or even just watching a loved one go through one, can put your brain on high alert. A major loss can completely shatter your sense of safety in the world. And sometimes it's learned. If you grew up with parents who were themselves trapped in that cycle of health worry, you might pick it up.
All right, this brings us to our last and maybe our most important section. Understanding all this is one thing, but getting real clarity through a proper diagnosis, that's a whole other ballgame. And we have to acknowledge this can be an incredibly tough, really frustrating step to take.
This quote from clinician Helen Tyre, man, it just says it all. People with severe health anxiety aren't faking it. They're not just looking for attention. They're genuinely suffering. The fear is real, the distress is real, and it can be one of the most isolating experiences a person can go through. So, how can you talk to a professional about this? Well, it's about preparing for a slightly different kind of conversation. Instead of just listing your physical symptoms, try documenting the entire cycle. The symptom, yeah, but also the thought that follows, the fear it causes, and the things you do to cope, like how often you're Googling or asking for reassurance. And most importantly, explain the impact this whole cycle is having on your life. That totally reframes the conversation from, find the disease I know I have, to help me with this pattern of distress that's ruining my life. It just opens the door to the right kind of help.
When you get right down to it, health anxiety isn't just about being afraid of dying. It's a pattern that keeps you from really living. We've seen how it's this self-fueling cycle of sensation, interpretation, fear, and behavior. But the biggest takeaway here is this. Just understanding how that worry works, seeing the engine in motion, that is the first and the most powerful step you can take toward getting your life back from that cycle of fear.